Welcome to this week's edition of Ask an MS Expert. I'm John Strum, and I'm the host of the Real Talk MS podcast. Each week, Real Talk MS reaches thousands of people in more than 100 countries around the world with the news that people affected by MS need to know. My wife, Jean, lived with progressive MS for 23 years, so I've had a front row seat experiencing all the ways that MS can impact a family. Currently, I'm a member of the International Progressive MS Alliance Scientific Steering Committee. I'm a district activist leader and trustee for the National MS Society, and I chair the Society's California Government Relations Advisory Committee. As we get underway today, I'd like to acknowledge and thank today's premier national sponsor, EMD Serono. Support from MS community partners helps the National MS Society reach its goal of providing up-to-date information and support through programs like Ask an MS Expert. And thank you to all of you who are joining us on GoToWebinar, Facebook Live, YouTube Live, and Twitch. The MS Society's Ask an MS Expert webcast is designed to connect you with MS experts who are ready to answer your questions on the topics that impact people affected by MS every day. So as I chat with our experts today, please feel free to post your questions in the GoToWebinar chat box. We'll try to answer as many of those questions as we can during the Q&A portion of today's program. And the Society's MS navigators are also online throughout today's program, answering questions and connecting you with resources. As the COVID-19 vaccine is now available for all Americans aged 16 and older, public health officials are urging everyone to get vaccinated as soon as possible. Today, we're talking about what you need to know before getting the vaccine, and we'll address your questions and concerns about safety, efficacy, side effects, and more. We'll be joined by two experts today. Dr. Dorlan Kimbrough is a neurologist in the Multiple Sclerosis and Neuroimmunology Division at Duke Health. He's an assistant professor of neurology at Duke University School of Medicine. And Dr. Kimbrough is a member of the group of experts the National MS Society convened to provide the Society's COVID vaccine guidance for people living with MS so that you can make informed decisions about the safety, efficacy, and the timing of COVID-19 vaccines with certain disease-modifying therapies. A bit later in today's program, we'll meet our second expert, Maite Ramos. Maite is a self-help group leader and a vlogger. She was diagnosed with relapsing remitting MS in 2015, and her goal is to help others find the motivation to live their lives to the fullest in spite of multiple sclerosis. Maite was fully vaccinated against COVID-19 earlier this month, and she's here today to share her experience. But now, let's welcome our first guest, Dr. Dorlan Kimbrough. Thank you for being with us today, Dr. Kimbrough.
Thank you, John. Good to see you.
Before we start, I just want to take a moment to remind our viewers that COVID-19 is a new coronavirus, and the published data available about this virus and MS are limited. The information and recommendations presented in this program are based upon individual professional opinion of MS experts and the evidence currently available about MS, COVID-19, vaccines, and disease-modifying therapies. The information that is shared does not substitute for your healthcare provider's recommendations. Please check with your healthcare provider before making any changes to your treatment plan. Dr. Kimbrough, the CDC and FDA issued a statement on April 13th announcing a pause of the Johnson & Johnson vaccine to give experts time to investigate an extremely rare blood clotting issue. Now, this pause may be lifted literally any time, but I know it's an issue of significant concern for some people. Can you explain what this blood clotting issue is and tell us how serious it is?
Sure, happy to do that. So as you mentioned, this is a bit of a moving target. And so, of course, we'll have a date stamp on this because the information could change for all we know by the evening today. So Essentially what we know so far is that there have been some rare blood clots, and I'll say the name once here. It's called a cerebral venous sinus thrombosis. But that's the long way of saying that these are blood clots that have occurred in the veins that drain blood away from the brain. And the problem with that is that it can injure the brain, and in some cases it's been very serious, but fortunately it's been quite rare too.
I was going to ask you, how common is it for someone to experience this sort of condition after receiving the vaccine? And how common is it for someone to experience the same condition even if they did not receive the vaccine?
Yeah, so there have been 6 reported cases of this out of just under 7 million doses of the vaccine given. So very rare. And in the general population, this happens about 5 out of 1 million. So it's exceedingly rare in both cases, not higher among individuals that have gotten the vaccine, but enough where, just out of an abundance of caution, there was a pause to take a look and make sure there weren't more cases or more information that needed to be gathered about it.
Are people living with MS at any greater risk for this particular condition if they happen to receive the J&J vaccine?
Not for this particular condition, no.
And if someone received the Johnson & Johnson vaccine earlier this month, is there anything that they need to be watching for?
Right, so if someone received the vaccine, the J&J vaccine over 3 weeks ago, chances are very, very, very small that this will have anything problematic happen for them. Even if it's been within 3 weeks, the chances are still very low. And some of the things to be on the lookout for would be severe headaches out of proportion to anything experienced before. Of course, and I mentioned the cerebral venous sinus thrombosis just to say that term again, but blood clots can also occur elsewhere too. So if there's chest pain, shortness of breath, abdominal pain, and getting back to the brain again, so headaches, seizures, things that are fairly obvious and severe and new, distinct from what people have experienced before. Those would be warning signs.
So what does this pause mean for the J&J vaccine? Do you expect the vaccine to be administered again?
So the pause means that it's still technically authorized, but it's just a call to let's just hold off for now and not administer anymore until there's been a review of all the data. There is a similar block that was placed in Europe recently, but that one was recently rescinded, I think as early as yesterday, yesterday or the day before. So we don't know when that will actually occur in the US. It's possible soon. It's speculation as to when that might happen, but it's possible that it could come back to being used pretty soon.
So what's the best advice that people living with MS should be following as this continues to unfold?
So these particular blood clots have been so rare that the fact that there's a pause and the chance to look at the data, that's just a sign that agencies are really doing their best to check into the safety of this. In general, it doesn't probably change much for the day-to-day behavior of most folks. They can there's other vaccines that are available as well that do not have a pause. So just continue the precautions, get vaccinated, and keep on with the way people have been managing in the recent weeks.
Well, I appreciate you adding some clarity to this issue that I know has some people very concerned. For the rest of our discussion today, we're going to focus on the 2 currently available mRNA vaccines from Pfizer-BioNTech and Moderna. Are those 2 vaccines safe for people with MS?
Short answer is yes. These are safe, and people ought to get vaccinated when they're able.
Does the MS Society's COVID vaccine guidance task force recommend one vaccine over another for people living with MS?
The standard answer is no. The more humorous answer is yes, the one that you can get first. The point here is that there's not a distinction that we're drawing between the vaccines about a preference per se. The idea is that when you have the opportunity to get a vaccine, unless there's some extraordinary circumstance between an individual and their doctor where they've decided to hold off, in general, folks should get the vaccine that's available to them.
Do these two vaccines have about the same efficacy?
Yeah, so the efficacy for these vaccines is pretty high. I think sometimes when you look at the numbers in these trials, sometimes there can be a little bit of comparing apples to oranges, and there's nuances of the studies. But the bottom line is that the vaccines that are available are effective and certainly have reduced the likelihood of people having severe outcomes with COVID-19.
Well, I'm hoping that everyone watching is going to take your advice and the advice of the task force and get the vaccine that's available to them. Let's talk about what happens when they do. What are some of the common side effects that people may experience after getting vaccinated?
Yeah, so similar to some other vaccines, there may be some pain at the injection site that may be sore. Some people may experience more generalized aches and pains. In some cases, people may feel fatigued, maybe mild headache. People have described it as sort of like flu-like symptoms without sort of the full-blown respiratory component of that. So there may be some period after that where people, after a vaccination, where people feel a little bit fatigued and sore, but generally speaking, those are fairly mild and usually resolve within days to a week or two.
And will people living with MS experience the same side effects as the general population might?
In general, it should be about the same. And there are some people have concerns whether or not vaccines might trigger an MS relapse, or whether it might cause them to have more symptoms than usual. So anytime there's a challenge to the immune system with vaccination, and we've seen this with other vaccines, it is possible that some people could feel some of their MS symptoms more prominently, or in some cases, people may happen to have a relapse afterwards. There have been a few preliminary studies so far that show that the rate of relapses is not higher than if someone hadn't had the vaccine. So it's not making a higher rate of that. So far, so good with just the routine management of side effects after a vaccine.
So once people have received that second shot, how long does it take before someone's considered fully vaccinated?
2 weeks after the last one. So if it's a 2-shot vaccine, then after the second one, 2 weeks beyond that is when someone's good to go. And if it's the single-shot vaccine, keeping in mind the pauses and so forth, if and when those become available again, then in any case, we're talking 2 weeks afterwards.
And once someone is fully vaccinated, does that mean that they can get together with family and friends without a mask?
Yes, within reason. So there are CDC guidelines, which listeners and viewers can review that go into detail about this. The general principle is that for individuals that are vaccinated, a group of vaccinated people, whether it's a family, a small group, typically within a few people, or let's say a household or so, it's reasonable for those folks to gather together safely without a mask. That said, there still ought to be some caution and be reasonable about this. It doesn't mean that necessarily large gatherings are wise, and it may be also important to keep in mind if an individual person in that group has more health concerns than other folks there, then you may even want to be cautious with that too, or check in with your physician about it.
Now, last week, Pfizer announced that people will likely need to get a booster shot at some point in the year. Emily actually wrote in saying a flu shot is needed every year. Will it be the same for the COVID-19 vaccine?
So this is where we're on the frontier of figuring out how this is going to play out in the long run. That's a possibility, but not guaranteed yet. It's not clear exactly what the timetable would be for booster scenarios.
When do you imagine that information might be confirmed, and how will we find out if a booster shot is needed?
Yeah, so I imagine that's, and this is just, I don't have something specific to point to here, but I imagine that as we get the first nationwide batch of vaccines out, so to speak, as this rollout is happening in the spring and into the early summer, after that goal is met of getting as many people vaccinated for the first time as possible, I would imagine that sometime, let's say this summer or early fall, we'll move towards hearing some information about that. And the same venues or channels that we get that information from, whether it's the CDC or FDA or manufacturers, I don't think it will be easy to miss that announcement when it does come.
Now, David wrote in saying that he's worried about the COVID-19 variants. Are the 2 mRNA vaccines effective against the known variants?
So far, so good. There's a variety of these different variants, and they're the scientific names, and then there's the names just by regions. The UK variant, and there are variants from in South Africa and Brazil and various places. That's more so, I guess, for the kind of the press's relay of that information to the public. But bottom line is that there have been several of these variants tested to see if there are sufficient antibody responses to the vaccine for them, and so far so good with that.
Our viewers, as you might imagine, have a lot of questions about the safety of the COVID vaccines with their MS medications. And the task force that you're a part of has provided guidance about COVID-19 vaccinations for people on MS disease-modifying therapies. What can you tell us about the safety of getting an mRNA vaccine while on a disease-modifying therapy?
So it is safe, and a lot of the questions that I'm hearing from people these days have to revolve around the timing of that and whether the vaccine will work properly and so on. So thus far, we've seen safety with administering the vaccine. And then in general, it's more important to get the vaccine than to worry about the timing. But in certain circumstances, we do have suggestions and considerations to apply for the timing of it for specific medications.
Do some disease-modifying therapies affect how well the vaccine works?
So the short answer is that the vaccines have still been seen to be effective with various MS treatments. Some of what we're looking at is extrapolated from looking at other vaccine studies and seeing how well the immune system responds for someone who is using one of the medications that affects the immune system. So just to be clear about some of these points, so in some cases, the level of protection is quote unquote lower. So the titer responses may not be as high as if someone wasn't taking that medication. But even with that, they're still sufficient. They're still above the threshold that you need to get protection. So there is still some protection, although there are individual circumstances where I'm sure doctors will look into that case for their patient about whether or not they happen to be someone that falls outside of that. But in general, these vaccines are effective despite treatments with disease-modifying therapies.
So we've heard from Jared, who was vaccinated against COVID-19 and then had an antibody test, which indicated he hadn't developed any antibodies. Jared is on a B-cell depleting therapy for MS. Could his MS medications be impacting his ability to develop COVID-19 antibodies?
So that is a possibility. We're still looking at data, and data is being collected to try to see how common that is and to what extent it happens. That is a possibility. It also depends on when those antibodies were tested for. The timing of the testing there might influence the results somewhat, but yeah, that is a possibility.
So what should Jared do to continue protecting himself from COVID-19? Should he be following the CDC's guidance for people who have already been fully vaccinated?
I think that would be reasonable. That's probably the most conservative way to go about it, is to just kind of take the precautions to ensure that you're not having any exposures that were kind of unnecessary. It may be worth it, and we're still looking at how the antibody testing plays into monitoring for this too. He may end up getting that repeated, but a lot of this will have to do with the personal circumstances of Jared there. So I think in terms of getting the rest of his situation looked at, certainly he'll need to be in touch with his neurologist and try to get a handle on what things look like for his MS treatment and for MS itself right now.
And how can people find out more about the timing of disease-modifying therapies with the vaccine?
So with the National Multiple Sclerosis Society website, there's information and several links about COVID-19, including one about the timing of the medications with respect to vaccination. Those details are there as just general guidance and considerations for patients and physicians. They're not written in stone to be followed absolutely just by the book, so to speak. But the point there is that there are some timing guidelines that are based on what we've seen so far. And the main point, though, is that if you're really in a pinch and you have an opportunity to get a vaccine and there's not a really compelling reason not to get one, in general, getting the vaccine may be more important than the timing of it, because COVID-19 has been so devastating.
Well, before we continue our discussion, I just want to take a moment to welcome those of you who have continued to join us. Please let us know what's on your mind. Type your questions into the question or chat box on GoToWebinar. We'll address as many of those as we can during the Q&A portion of today's program. And MS Navigators are online throughout today's program, answering your questions and connecting you with resources. Our Ask an MS Expert program takes place at this same time every Friday. So please help us make sure that everyone knows about it by sharing news about the webcast with your family and your friends. Public health officials are estimating that between 70 and 90% of all Americans are going to need to be vaccinated in order for our country to achieve herd immunity. Vaccine confidence seems to be rising, but recent polling suggests that a significant percentage of Americans still want to take a wait-and-see approach, and about 20% say they won't get vaccinated. The pause in distributing the J&J vaccine could have an impact on vaccine confidence as well. So let's talk about some of the concerns about the COVID-19 vaccine that we've been hearing from our viewers. Maria is worried about long-term side effects. Dr. Kimbrough, what's the available evidence telling us about long-term side effects?
So it's understandable and reasonable to be concerned about the possibility of having long-term issues with any new medication or vaccine or anything that's being introduced into someone's body. Thus far, we don't have any evidence of any long-term effects. And also this has been very recently that we've started vaccines for COVID-19. Looking in general, though, we don't have a lot to sort of hang our hat on in terms of seeing bad outcomes related to that. So far, so good.
Well, we've also heard from Reggie, and you actually started answering Reggie's question a few moments ago. Reggie hasn't made up his mind about getting vaccinated because he's concerned it will trigger an MS relapse. So could the vaccine trigger that relapse? And what should someone do if MS symptoms start to flare after they receive their first shot? Should that person get the second shot?
Yeah, so that's a good question. Very understandable concerns there. So as we talked about earlier, so anytime there's a challenge to the immune system, some people may experience more symptoms afterwards. In some cases, there have been individuals that have had relapses after vaccines. In general, though, from what we see with the COVID-19 vaccine, we haven't seen a higher rate of relapses with that than otherwise. And so in terms of getting the vaccine, we're also comparing this to COVID-19 itself and the terrible outcomes and hospitalizations and the lethality of that. So that's one thing to weigh against. MS relapses, we know how to handle pretty well in terms of the usual treatments for that. And John, could you remind me the second half of that question?
Oh, absolutely. If someone is experiencing a flare in their MS symptoms after receiving their first shot, should that person still get the second shot?
So the first thing to do there is to make their neurologist aware of it and get that investigated. Because a lot of times people understandably use the term flare or attack or exacerbation in different ways to describe what they're feeling. And having increased symptoms after a vaccine does not necessarily mean that MS is all of a sudden misbehaving. There could be other issues at stake. So it's important to really get a good handle on what's happening in that scenario. Is this a true MS relapse? Are there new MRI lesions? Is this just kind of feeling uncomfortable after the vaccine? So the first step there would be to make their neurologist aware of it and get it investigated before making a decision about getting the second shot or not.
Abby wrote in saying that she's had severe allergic reactions to various drugs and substances in the past, and she's worried about having a reaction to the vaccine. Should people with allergies get vaccinated?
So if someone has had a serious, we call them anaphylactic reactions, or like the worst allergy you can imagine. So shortness of breath and drop in blood pressure, these sorts of things. Certainly someone who's had that kind of problem with the vaccine before, it may be questionable as to whether they could get it, and that's something that you'll need to make your doctor aware of. That's different than having, let's say, seasonal allergies to pollen, or if you're, you have a certain detergent that maybe gives you a rash. People mean different things by allergies. So I would say certainly severe anaphylactic reactions, that would be a reason to have pause about it. The other issues ought to be discussed with your physician to see if it's something enough to argue against the vaccine, or at least for monitoring if you were to get the vaccine.
And what should someone do if they have an allergic reaction after being vaccinated?
Yeah, so in general, this may depend on the place, but a lot of places that have the vaccine administration will actually make you wait for 15 minutes or so afterwards, which is reasonable to try to just catch folks who may have a sudden crash with shortness of breath and other urgent symptoms like that. But certainly if you have shortness of breath, a large rash, you feel lightheaded, any urgent symptoms like that, definitely need to seek medical attention emergently in that case. If there's other signs of that maybe don't rise to that level, but they're occurring in the day or so afterwards, again, make your doctor aware and get things checked out, because that also needs to be evaluated in the context of your health overall and what other things have happened recently.
Linda told us she's feeling anxious because the mRNA vaccines are new, and she's skeptical about the safety of the technology that was used to develop them. Dr. Kimbrough, what can you tell us about this new approach to vaccines?
There are some in the scientific community that, while no one is a fan of the pandemic, the fact that this pandemic has been such a it's had this pace and caused all of these this just calamity all around. It's really accelerated the implementation of technology that was kind of coming along slowly, kind of from a research standpoint before. So my point is that this is an opportunity to have this new technology be brought out and applied faster than it otherwise would have, which in a way helps to get the vaccine out to people more quickly, and it's effective and it's safe. I mean, this is, it's mainly a vehicle of introducing the vaccine that makes the production of it a lot swifter than some of the methods before. And when you have a worldwide pandemic, it's important to move swiftly. And so that's why this technology was employed for this particular vaccine.
There have been all sorts of myths and stories circulating on various social media platforms that mRNA vaccines can alter someone's DNA, they can cause infertility in women, and even that they're full of dangerous toxins. Dr. Kimbrough, would you mind clearing up some of these myths for us?
Yeah, so going back to what we talked about earlier, there's concern about this pause of the of one of the vaccines that we started the program with, and the point of that pause, I'll just say this: with 6 cases of that those blood clots for the veins that drain the brain, those 6 blood clots out of nearly 7 million doses of the vaccine administered. There are a lot of folks, you know, some scientists and not scientists, that would say, hey, like, that's so rare. That's astronomically rare. Like, yeah, these kinds of things happen. Why stop everything just to kind of, you know, investigate that further? Now, in general, the answer to that is to be extra cautious about the safety of the drug and to make sure that it's being thoroughly evaluated. So here, when we're talking about these other, the myths that you mentioned, I think one thing that can be reassuring is that like the minute anything seems kind of that it doesn't quite add up or there's been any concern, I mean, we've seen just with the blood clots we're talking about here, like immediately there's investigation of what's going on. And so if there were, you know, some of the things that are being reported, sometimes it's social media, sometimes it's the far corners of the internet, a lot of these things that are being talked about would have captured notice and would have brought a lot of scrutiny. And so I think there's a lot that are just patently false. But one other thing I want to say too is that some of these issues of myths have to do with, I think, understandable fear of dealing with the pandemic and then having a new vaccine, a new not treatment, but a new vaccine that's available. And the idea of doing something brand new under scary circumstances is frightening. And so sometimes, at least when I talk to some individuals, what I take away from the conversation is not so much that people really believe in the myth per se, but that they are afraid of doing something that is frightening, understandably. And sometimes, you know, in our culture, there's a need to find a reason that sounds scientific to back it up. But it's okay to be afraid. It's okay to just acknowledge that there's some fear and some concern about whether or not you want to go ahead and do something so new and you know, that's just really disconcerting. So I think sometimes the myths are kind of like a, I mean, the myths are kind of like a just a manifestation of the fear that's out there. And I think the more we get the message out about what the science says and about what we're actually seeing, that the more those myths can be dispelled.
Well, COVID-19 has disproportionately affected minority communities, and getting vaccinated is exactly what can help keep the people in these communities safe. But a history of medical mistreatment and discrimination in our healthcare system are both causes of concern for people of color when it comes to being vaccinated. So maybe you can share with us a little bit about how communities of color have been affected, impacted by COVID-19, and what effect this is all having on vaccine confidence.
Yeah, so as many people are aware, a lot of the statistics about the impact of disability and intensive care unit stays and mortality have been very dire and disproportionate for lots of communities, particularly Black patients, Hispanic patients. Sometimes that has to do, and a lot of it may have to do with some of the comorbidities in terms of sometimes cardiovascular disease and pulmonary disease, among many other things that that can raise the risk of bad outcomes with COVID-19. So when it comes to the vaccination, it's important to use this as a tool to try to mitigate some of that risk, so that the spread can be slowed down. And frankly, there are a lot of places where the vaccine is starting to roll out, where it would be really useful for people to take advantage of that, and again, not only for themselves as an individual, because as we know, most people don't have the worst outcome with COVID, but the problem is if you're someone that's spreading it, then that just contributes to this snowball effect of it going throughout the population. So again, vaccination is key.
Well, knowing that health disparities exist, how can people of color feel confident that getting that vaccine is safe and effective for them? What can be done to help amplify that very important message?
Yeah, I think, well, people who have gotten the vaccine can share their experience. I have been vaccinated. Many people in my family have been vaccinated. I think having knowing people that have experienced it, and hey, I've got the vaccine, I'm fine. A little bit of soreness in the shoulder, and that was it, and it's okay. That's one thing that can be helpful. Obviously, outreach programs from various organizations, whether it's public health agencies and governmental healthcare organizations, patient advocacy organizations, that can be useful. Those are ways to get the word out. And again, the data is out there about the efficacy and the safety of these vaccines, to the extent that you have some places where the vaccine is being offered, and in the local community, there may be people that are reluctant to take the vaccine. But then again, you have people driving from outside the community going there to get the vaccine. So I think it's important for everybody to try to understand that a lot of this has been very well vetted, and there's an urgent need to get this word out there.
Well, speaking directly about that vetting, we've heard from Shawanda, who says she knows it's important to get the vaccine, but she's wondering if people of color were represented in the vaccine clinical trials, and were there enough to fully understand the impact of the vaccine on this specific population?
So with clinical trials in general, there's always questions about the extent to which it's representative of the population. In terms of looking at that sort of data, I don't have the specific numbers on that. We may be able to look that up and get that into the chat here. In terms of a representative sample, this has been all over the country. This has been, and frankly, all over the world as well too. And when you're looking at the efficacy of the vaccine, if the vaccine is effective to begin with from the data that we have, and we're looking at the populations that have been most affected by COVID-19, it stands to reason that, if you're trying to reduce a very large disparity, that we'd expect to see some benefit there. So I would definitely still encourage folks to get vaccinated, because we're trying to prevent that mortality data from mushrooming as it had been, especially when this came on the scene a year ago.
Well, in general terms, vaccines protect us from getting sick. These specific vaccines are important tools for helping us all get back to a more normal way of life. So let's talk about some of the things you should know before getting your vaccine. For instance, is it recommended to take over-the-counter medicines like ibuprofen or acetaminophen before getting the vaccine to prevent any of those side effects you mentioned earlier?
So that can be reasonable in some circumstances. Most people are able to, at least that in my clinical experience, most people are able to tolerate it without it, but mild analgesia, staying hydrated, and rest is usually sufficient.
Daryl recently received the shingles vaccine, and he's asking, what is the guidance for getting the COVID-19 vaccine around the same time as another vaccine?
Generally speaking, you want to have at least 2 weeks between various vaccines. So they should be spaced out and not sort of all right together in that case.
Amy wrote in telling us she's had some cognitive decline due to MS, and she's worried that she might forget to get her second shot within the recommended time frame. Are there any systems in place to remind people when they need to be getting that second shot?
So in some cases, yes, it depends a little bit on where the vaccine was administered. So for some facilities, when you get the first dose, there's automatically a reminder about the second dose. The same way, for example, with some clinics and doctor's appointments, it's just a call or a letter that's saying that you're supposed to come back for the second one. If you don't have that built in, it's always helpful to have an acquaintance, family member, associate, loved one, someone that can be involved with you to try to help facilitate that.
Debbie wrote in saying that she recently had COVID-19 and she wonders, should she still be vaccinated?
Depends on how recent. And this is also a moving target too about how long one may have immunity after exposure to COVID itself. And so the numbers on that, like I said, are kind of variable here, and this gets back to earlier questions about whether we'll need boosters in the future and so on. So I think it remains to be seen about what the actual timeline would be for that. But if you've just immediately had COVID, probably not. But we're talking like 3, 4, 5 months. I'm just saying those numbers. We'll have to see what the actual numbers are. But if it's been longer, then at that point, we may end up having folks get vaccinated.
Well, thank you, Dr. Kimbrough. We're going to circle back to you in just a few minutes. Now I'd like to ask Maite Ramos to join us. And she should be with us in just, there you are. Welcome, Maite. Thank you for being part of this important conversation.
Thank you. It is my privilege. Thank you so much.
So let's dive right into your experience getting vaccinated. When did you receive your vaccination and which vaccine was available to you?
Yeah, so I was vaccinated. I got the first one on March 31st. It was Pfizer. And the second one, April 21st, which was just 2 days ago.
So how did you feel after getting the first shot? And how did you feel after getting the second shot?
After I got the first one, I felt a little dizzy, maybe within 10 minutes, but nothing major. I felt some weird pressure on the back of my head, very similar to when your sugar levels go down. Was very similar to that. Also, some taste of metal in my mouth, which is familiar to me because it was very similar to when I get IV steroids. So it was no big deal. After I was dismissed, I went straight to have lunch, and everything that I was feeling just went away. And I had a great day. After several hours, I had a little bit of a headache that I don't even consider a headache because it wasn't a constant headache. It was intermittent, and I didn't even have to take any medications for it. So it resolved on its own. Later at night, I started to get a little bit of pain on the arm, very mild. I was even able to like sleep on that side. So that goes to tell you that it wasn't anything that was too painful. And that resolved within 2 days or so. Then the second time around, it was very different. I did not have any of those symptoms. I had maybe a little bit of pain later at night on the arm. It was even less than the first time. I didn't have to ice it or nothing, and it went away. Actually, it was just 2 days ago, and as you can see, I can move my arm without a problem. So overall, I think that the symptoms were very mild and manageable.
Did you experience any worsening of your MS symptoms?
No, not at all.
Well, that's wonderful. You know, everyone who chooses to get vaccinated does it for a reason, whether it's to protect themselves, their family, maybe to resume activities they once enjoyed, or maybe to just help our communities get back to a more normal day-to-day life. Maite, what was your reason for getting vaccinated?
Well, of course, my first priority was to protect my family and protect myself. But I also wanted to go back to my occupational and physical therapies. I have stayed at home probably more than other people that I know. The idea of going into a building surrounded by strangers in an enclosed environment was a little scary. So for a full year, I did not go to therapy. And that definitely took a toll on my physical condition. I deteriorated a little more. So over time, as I learned how to stay safe, and as I learned the safety measures that are being taken, and as I learned the precautionary measures that are being taken in the rehabilitation center that I go to, I felt like it was time for me to go back and take care of myself. So being fully vaccinated gives me that peace of mind that I highly needed. And another reason that I had is that I really love to travel. So I can't wait for things to get back to normal and be able to safely go to places.
So let me take you back to the days and maybe weeks before your first vaccination shot. Did you have any worries about getting the vaccine? And if you did, how did you overcome them?
And I would say more like in the beginning of the vaccination process around the world, I was afraid. I was skeptical. I was apprehensive. And my strategy was to just sit back and watch how things were unfolding and see how people were reacting to the vaccine. Also, I had no choice but to wait because of the age group, that I belonged to was not a priority group. MS was not one of the high-risk chronic diseases in the list to get priority. And unfortunately, fortunately, I should say, I don't have any other chronic disease, so I didn't qualify whatsoever to be in the first groups. So I had no choice but to wait, and that allowed me the time that I needed for me to be able to see how people were reacting, talk to MSers that were vaccinated and get their feedback and hear from them what their experience was. And that definitely helped me make my decision to get the vaccine.
Do you have any family members or friends who aren't ready to get vaccinated, or maybe who don't want to get the vaccine at all? How do you talk to them? What do you say?
Yeah, I have a couple of friends that at this point they are on board. They're going to get the vaccine, or they have already taken at least one, the first one. But they were also not 100% convinced. But there is one special person in my family that don't want to take the vaccine, and that's my oldest son. So I was curious to find out what was stopping him. Why was he, so why he didn't want to get the vaccine. And when I talked to him, I quickly realized that he didn't have the true facts of the vaccine. He didn't know how the vaccine was made. Excuse me. He didn't know how the vaccine works in your body. All he knew, I noticed that he was just paying too much attention to those myths that you mentioned earlier. There's a bunch of made-up stories that are flying around the internet, a lot of false information. And he was, unfortunately, paying too much attention to that. He was lacking the correct information. He didn't know nothing about the vaccine. So once I explained to him and I gave him the correct information, then he changed his mind. I also expressed to him how important it is to not just think about himself, but think about the others around him. In our house, we have 2 little ones that are too young to get vaccinated, so they're still at risk. And that did it for him. So right now he has an appointment and he will get vaccinated.
Well, thank you for sharing your experience, your suggestions, especially that story. I think it's going to help a lot of people. Now I'd like to invite Dr. Kimbrough to rejoin us. I think over our time together, you've both shared some important and helpful insights with us today. So I'd like to ask each of you to share the top 3 takeaways that you'd like our audience to remember. And I'll start with you, Dr. Kimbrough. What are your top 3 takeaways?
Sure, thanks. Just before I do that, there was a question earlier about whether the trials for the vaccines were representative of the population at large. And so I just took another look at that data, and so they were quite representative. So if you look at the various groups that were in the trials and also just at the US Census population, so there's very good representation there. So I think we can be definitely confident about the administration of this vaccine for everyone. So that said, as far as the 3 takeaways, number 1, get vaccinated if and when you can, when it becomes available, unless there's some really strong reason figured out by someone and their physician. In general, people should get the vaccine. It's reasonable to continue, for number 2, it's reasonable to continue MS treatment, and that the timing of the vaccine may not be as important as just getting the vaccine to begin with. And then thirdly, continue to take reasonable precautions as outlined by the CDC and other public health agencies.
Your turn, Maite. What are your top 3 takeaway messages for today?
I would say number 1, if you still are not fully convinced, please get your information from reliable sources, whether it's your doctor or the MS Society website or other MS organizations that have accurate information on their pages. Second, I would say get your own data, and you get that from speaking with other MSers. Talk to people that have MS and have been vaccinated, and connect with those people. There's many ways online you can connect with people. This topic is being discussed every day, all day long. People are sharing their experiences, and that is your best reference. And 3, don't be scared to get the vaccine. The vaccines are safe, and don't let your MS diagnosis stop you from getting vaccinated, because I believe from my own experience as an MS patient that our bodies, even though we have the condition, are capable of metabolizing the vaccine pretty good. And don't be scared of side effects, because it's better to deal with side effects that resolve in a couple of days than getting the COVID infection.
Well, thanks to all of you who submitted your questions. And thank you, Maite Ramos and Dr. Dorlan Kimbrough, for being with us today.
Thank you. My pleasure.
Thank you.
I think that one of the best things that anyone can do for themselves, especially during these uncertain times, is to make sure that the information they're receiving is credible and reliable. So we'd like to share some resources with you, and these are resources that you can count on to be current and credible. For more information about MS, COVID-19, and mRNA vaccine guidance, and guidance on timing your vaccine with your disease-modifying therapies, please visit the Society's website at nationalmssociety.org/COVID-19. I want to remind you that the National MS Society's MS Navigator team is your best partner when it comes to connecting you to the very best information and resources on living with MS. You can reach an MS Navigator by phone, email, or through the Society's website by chat. And I'll also remind you that the MS Society brings people together through peer connection programs like self-help groups, the MS Friends Helpline and Paired Program, and the National MS Society Facebook community. To learn more, please visit the Society's website at nationalmssociety.org/connections programs. And I also want to mention that Maite Ramos has a Spanish-speaking support group specifically for people from Puerto Rico who are living with MS. Every week on the Real Talk MS podcast, I continue the conversation that we start here. So I hope you'll take a few minutes and give Real Talk MS a listen. You'll find the Real Talk MS podcast at realtalkms.com, Apple Podcasts, Google Podcasts, Spotify, Amazon Music, wherever you find your favorite podcasts. Walk MS 2021 is coming, and this year, Walk MS will meet you where you are to connect, celebrate, and make a difference like never before. For more information, please visit walkms.org. You can connect with the National MS Society along with others affected by MS on Facebook, Instagram, Twitter, YouTube, and LinkedIn. I encourage you to like the posts, subscribe to the channels, and make sure that you're on the Society's mailing list so you'll continue to receive the latest information on MS and updates on upcoming programs like this one. And I'd like to thank Dr. Dorlan Kimbrough and Maite Ramos for joining us today. Please remember that a recording of this webinar will be available at the Society's website at nationalmssociety.org/MSexpert, as well as on Facebook and YouTube. I hope you'll join us for next Friday's edition of Ask an MS Expert, when we're going to be talking about MS therapies with Ross Tingen, pharmacist clinician at the University of Virginia Medical Center. You'll learn how those therapies work, how to manage side effects, medication timing, and therapy follow-up. Now I have a favor to ask each of you. Getting your feedback on today's webinar is important. So you'll see a survey pop up in a moment when we close out the webinar. And if you're watching on Facebook Live, you'll see a link to that survey pinned to the comments section. On YouTube, you'll find that link in the program description. Completing the survey makes a real difference. The information you provide helps us continuously improve, and it helps shape future programs. The survey takes just 1 minute, so I hope you'll take a minute and please fill it out. On behalf of Dr. Dorlan Kimbrough, Maite Ramos, and the National MS Society, I want to thank you once again for joining us. Please stay safe and make healthy choices.